So first of all, good evening. I am yours truly, Dr. Pierre. If this is your first time joining, this is my episode of Doctors Reacts, Real Physician Reacts, where I come on and I just talk about a topic that comes across the social media feed one way, shape, or form. Tonight, we're talking about COVID. Now, this is a topic that people have been wanting to talk about. So I'm opening up the floodgates to talk about COVID. But I'm going to start off with the most recent news that we heard earlier this week, which is President Biden is ending. Well, ending is a tough word, right? I'll say not renewing the public health emergency protections and rules and regulations and everything that went with it. That's ending. That's coming down in May. And for a lot of people who may be nervous, may be concerned what this is even mean, we're going to talk about that tonight. We're going to try to answer some COVID-related questions, vaccine-related questions, because I know you have them. So anytime I give one of my COVID reviews, and first of all, appreciate you joining. Make sure you send likes. Make sure you send some hearts. Make sure you're sharing away. Anytime I talk about COVID, I like to give us kind of an overview of what to expect, what we're dealing with when we're talking about COVID as far as the numbers are concerned, because it's one thing to kind of just talk about COVID and live COVID, but like really understanding just how significant COVID has been in these past 3+ years is extremely important, right? So let's give some numbers out. We'll talk about cases, we'll talk about deaths, we'll talk about vaccination, just so we can kind of get it over with. That's a very good question. Someone's asking, is it over with? That's a very good question here. So here in the United States, we have had a total of 102 million cases with 1.1 million deaths. As far as vaccinations are concerned, because I know that's always big. Hey, how you doing? 668 million doses of vaccines have been given out here in the United States, with 69.7% of the population being vaccinated. Now, you may remember, especially in the early pandemic, a big number we were looking for was 70%. 70%. Like, can we ever get to 70%? Of course, we were hoping to get to that 70% in like the year, like when it first hit. Obviously, it did not happen. But as we kind of move forward, we're inching, we're getting close, but obviously the pace has dropped, right? So let's talk about worldwide numbers, because obviously we are a global society. We understand when we talk about pandemic, we're talking about a disease that affects the world. You know, remember the world shut down, right? So this is what's happened worldwide. 670 million cases, 13 billion with a B vaccine doses have been given out worldwide, with 65% of the world being vaccinated. And again, I think that's important, especially when we talk about the level of context, when we talk about how did we get to this point here where in a few months, the United States has said, hey, you know what? These public health declarations, these public health emergency, and more importantly, the state of emergency that we put out there were taken away. Like, how did we get to this point here? And more importantly, for the common general person, what does this mean? So I posted a video earlier this week when I talked about how concerned I was with the ending of the public health emergency statute, right? And for those who may not know, especially if you're just your first time seeing me, following me one way, shape, or form, I always speak at the level of those who are typically deprived, typically underserved, typically uncared for, undercared for. So a lot of times when I'm speaking from that level, right, of a point of view. So when I see something like the public health emergency as state of emergency is kind of going away. Now, mind you, the writing has been on the wall, especially if you're politically inclined and you kind of keep up to that. Our government, right, the government that we have, they weren't renewing the finances. They weren't renewing the aid for COVID-19 help. It's the reason why we had less people testing. It's the reason why we had less companies and organizations giving out tests. That's the reason why because the government wasn't cutting those checks no more. So the writing has been on the wall for the decision that we're at today, right? So none of us, especially us, none of us are shocked that we've gotten to this point. But it's still, obviously, it's still disheartening, especially when we talk about as far as deaths, right? Like COVID deaths, we had 1.1 million, 900 people died yesterday of COVID. And so we've gotten to a point, especially in this country, and, you know, we've gotten to a point in this country where we're okay with 900 people dying. We're okay with that. Like, that's a sobering fact. But because it's not on the TV anymore, because it's not constantly being blasted over and over and over again, it's just like, oh, okay, 900 people died. So as we move to this point, and we're talking about the fact that they're going to start removing restrictions away, and they're going to take this state of emergency away, we have to ask ourselves, like, all right, what does this mean for the common person? So let's give some scenarios of what occurs now because we have this state of emergency. Because we have this state of emergency now, if I want to get tested for COVID, guess what I do? I just go to the store. I just go to your local pharmacy. I get tested for COVID. If I want to get treated for COVID, guess what I do? I follow up with one of my clinicians or someone in the health department. They write me a prescription, and that prescription is paid for, right? So, like, the treatment, especially when we talk about outpatient basis, that's treated. If you're one of the unfortunate people who get treated on an inpatient basis for COVID, we know that, especially from a hospital-related standpoint, the hospitals actually get reimbursed more because they know it actually costs more. Yes, that what 900 people was in the United States. We know that it costs more to take care of COVID patients, so the hospitals are actually getting reimbursed more. From a hospital perspective, one of the weird rules that we used to have is that if you got admitted to the hospital and you were ready to go to a skilled nursing facility, like a rehab, like the patients I take care of, you had to wait 72 hours. Now, don't ask me where they got this crazy rule from, but you had to wait 72 hours for that to occur. Now, because of the public health emergency, you can just go. We had around the corner people testing. We had drive-by testing. We had vaccination. Like, if you want a vaccine right now, you could just go get it. You weren't concerned about the cost of getting said vaccine. I saw some people kind of get a little bit of an uproar because Moderna, I think it was Moderna, had put out that they were going to start charging for the vaccine. You know the reason why? Oh, thank you. Moderna had put out that they were going to start charging for the vaccine. You know the reason why? Oh, thank you. Someone said they love the shirt. You know the reason why you can't charge for the vaccine now? Because this public health emergency. This public health emergency is not allowing, I don't want to say not allowing, let me take that back. This public health emergency essentially is compensating these companies, the Modernas, the Pfizer, the Johnson & Johnson, the Novartis. They're compensating these companies for the vaccines they're providing. So you just go in, you get your vaccine, it's free, you're keeping it moving. So it's you're going to see, especially up until the day that it officially ends. I hate to say push, because push seems so bad. Especially because I see the YouTube comments and they call me a double agent for Pfizer and Moderna. Like, push seems so bad, but I highly recommend getting vaccinated. I highly recommend getting boosted because I know it's free right now. So we're going to have a significant population of people who are not going to be able to have access to a vaccine, who are not going to be able to have access to a boost. Now, mind you, it's going to be there. You can go to your Walgreens, your pharmacy. Yeah, encourage. I love that. Encourage is a better word. I strongly encourage people to get vaccinated. So it's not like these vaccines are disappearing from the pharmacies of the world. But what's going to happen is that now all of a sudden a cost comes with it. Even if, let's say you happen to be insured, right? Again, even if you're insured, you don't have to pay nothing. Guess what you're going to have to do? You're going to have to start worrying about co-pays. There are so many things that are about to happen once that state of emergency gets lifted, that I think is going to be a culture shock for a lot of people, especially people who have been kind of ho-humming. And that is definitely true. Your insurance may or may not cover it. So for those who've been just kind of chilling, waiting, maybe not. Once that day comes and you have no choice and you start seeing people say that this Pfizer vaccine, the same vaccine that was free a month ago, is $150, is $100. Like that is where I think the culture shock is going to come for a lot of people. And of course, what typically happens is those who are underserved, those who are uninsured, those who are underinsured, because we have a lot of people in this country who are underinsured as well, they are primarily going to continue to get affected by the change. And again, this is a change that is going to happen. If there's nothing that, like, and again, I saw a lot of people blaming Biden, right? But again, it's short-sighted. It's short-sighted to blame the administration. He can only do so much. And again, I'm not the, super Biden supporter, even though, well, yeah, especially if I got to talk about a comparison, yeah, I am. But he can only do so much when there's no funding. And he already has a Congress that's not going to allow funding to occur. So he has to do it. So fortunately, he's at least given the states a couple months to kind of prepare. He's given the states, he's given the health clinics, he's given them a couple months to kind of prepare for what's about to go down. And I think it's going to be important for us, especially for us content creators, health content creators, public health professionals, those who are really, educating their communities to let people know, like, there is going to be a drastic change. Now, mind you, I just mentioned, like, deaths are still happening. Like, people are still dying, right? So, and by the hundreds daily. So it's not as if we've turned this corner as far as the number of deaths. It's not, we haven't turned that corner yet, but we've just gotten pushed to a place where, you know what, they're just going to do what they're going to do, right? So, let me stop my monologue. We'll get to some questions here. But like, I'm really trying to stress that it's really going to be a problem. Especially once these criteria and I was looking, in fact, let me see if I have some other things that are coming, that are going to be going away once that occurs, as far as the public health, right? Before we get to questions. We talked about how hospitals are going to get less funding because of it. Oh, those who are on COBRA insurance, expect those patients start getting dropped from, especially people who start getting dropped from those plans as well. You have a lot of protections from an insurance related standpoint, as far as them dropping you, as far as them requiring to pick up the cost. Disability is going to be a big one. Long COVID has definitely been something that you see continue to be on the forefront of discussion. That's going to ramp up once the protections that is available now go away. Let me see if I have anything big for you. That's what a lot of the big ones. A lot of other ones are more insurance related. That we may talk about it especially if I get a question on it. But a lot of it's insurance related. But again, you're just going to see the costs. You're seeing costs rise, right? So we got our first. So this is just kind of our first question here. Let me see if I can highlight, pin this. So. Rafi, I apologize. Rahi, I apologize. I pronounced it incorrect. So he's asking, is COVID over? So this is what is probably driving people like me, people like Dr. Rubin, Laughter and Light, neighborhood virologists, and all others kind of wild, because we have continuously been making moves as if we've gotten over the hump. And I'm on record to say some of the things that will tell you that we've gotten over a hump is that we have a good, percentage of our people vaccinated. We kind of got that. Again, we're at the 69%, could be higher. I'm in the state of Florida. We're around 70%. So at least, all right, kind of check. Even though, and that's just the vaccination. When we talk about those who've been vaccinated and updated with boosted, that number drops under 25%. So yes, we got a lot of people who've gotten that first series. But when we talk about people who need to get boosted, especially while it's free, that number drops significantly, especially because we know what these variants are doing. So we see not necessarily a rise in cases. They're just kind of remaining steady. Our deaths are remaining steady. So these are very classic signs of, we just turned the corner. We're like there. But what's happened, especially from a public health perspective, is that we're just saying like, hey, you know what? COVID is here. And COVID is something we're going to have to live with. And because COVID is something we have to live with, I can't keep these public health emergency protocols in play anymore. Like I'm gonna have to allow Moderna and Pfizer. Like if you think people hate Pfizer and Moderna, even though Moderna doesn't get really hate right now, which is just so weird to me, and Johnson & Johnson, they don't get that much hate. If you think people hate these vaccines company now, wait till folks start hearing the prices that they start charging for a vaccine that our government funded. Right? Wait till, yeah. That's really when it's going to be a different ball game. Oh, this is a very good question, right? And this is a very common question I get, right? Hi, I haven't had COVID yet. Is this possible? Yeah, there's a lot of people. It's not out of, like, obviously what we read, like 102 million. It's not out of the ordinary for someone not to have gotten COVID, right? For lots of different reasons. Let's think about this, right? You might have had COVID but been asymptomatic from it, right? You could have been one of the lucky ones, right? And because you're asymptomatic, there's no reason to test you. You may have been routinely tested, but guess what? When they test you happen to be negative. So yes, there's a lot of people still to this day kind of dodging COVID. Like it just has not come across. Now I tell you, like I work in a hospital, work in rehabs, work in long-term care center. My whole family has tested for COVID, and I have not tested positive for COVID. I don't know how that's possible. Of course, my wife blames me for giving the family COVID. She might be right, but like when she was feeling ill, when the kids were feeling ill, now mind you, we were all vaccinated and boosted, so the illness was like for a day or so, because that's how it's supposed to be. We go to get tested. I'm the only one who came back negative. Again, I don't know how that works. I don't know how that goes, but yes, there are a lot of people who are still pretty diligent about not getting it. I don't want no one to get it. I don't want no one to have a first time experience of it, because we don't know how someone's first time experience of it will be. You may be one of those people who get asymptomatic, never even know about it. You may be one of the ones who, let's say you're vaccinated, boosted, you get it, get a little sniffle and keep it moving. You may be one of the fortunate ones. But if you're not, right, we don't want you to end up sick to the point where, you have to go, see a doctor, and then you have to go to the hospital. We don't even want to test that. And so that's why it used to drive me crazy when I would hear people say, oh, it's only a 1-2% mortality rate, 1-2% mortality rate. Because one, they're totally neglecting all of the people who will forever be disabled from the disease. The people who survived, right, who didn't die from it, but because they didn't die from it, now they forever are on either a breathing machine, they've had a tube breathe through them, they've been trached, right, they've had PEG. Like there's a lot of people who fit that category as well, which especially with these public health emergencies ending, I'm very concerned about, because if people don't recognize and don't start, doing the things they need to do, aka seeing doctors, getting documentation, when it comes time to fill out for disability, problems can arise. So again, there's so many protections that were available to us because we had these public health protections involved, that now that it's going away, like it is definitely fearful. Let's see here. Let's see. Yep, we had a lot of people who haven't gotten it yet. So this is a good question, right? So guessing it will be a while till we hit herd immunity, or am I wrong? So good question, right? So when we talked, especially in the beginning, when we were talking about like, all right, guys, if we could just get to 70%, if we could just get to 7%, the reason why we were trying to hit that as quickly as we did was because we knew that if we could get a good amount of this population vaccinated, protected, we can try to foresee blocking and getting out the way of these variants that we knew were going to come. I think a lot of people, especially when they hear the new variant, this new variant, that, I think a lot of people feel that like those on our side, like are shocked by, surprised by. We just know how viruses work. The same way antibiotics worked. If they're allowed to replicate over and over and over again, eventually you'll get one that goes off the greener pasture, and all of a sudden it's a little bit more virulent than the next one, right? All of a sudden it's a little more deadly than the next one. So that's why we were trying to get so many vaccinated in the beginning so we could try to slow down the pace of the variants. Of course, it didn't happen. So it's the reason why we had Delta when we did. It's the reason why we had Omicron when we did, and BH 1.55. It's the reason why we keep having these variants, because we still continue to have these pockets, and because we had the pockets of variants coming around. Now it had time to whip back around and say, hey, yeah, I know you got vaccinated early, but I'm a new strain. So whatever vaccine you got before, it don't really matter. Right? So why we encourage people to get boosted. So that was kind of our forethought, especially in the beginning, with Dr. Fauci and everybody saying like, oh, let's get vaccinated, because we were trying to slow that rate of progress down. So when you look at some of these charts, it didn't look like like a huge hill. Like, in fact, I don't know if I can pull up. I don't know if you guys can see. Let's see if you can. Might not be a great. I don't have a good view. Eventually, I'll be able to do this from the desktop, and I can show my desktop COVID cases. I'll let that see if I can now pull up. But we have these huge spikes and huge hills because variants just run amok and then go. So now we have boosters that need to be done. And just like, and boosters, I know is the word that we hear, but think about every year when we talk about getting a flu shot, that's essentially is a flu booster. We just don't call it a flu booster anymore because it's just the flu shot. So that's the definitely direction COVID is going. I've told people all the time. Do we have it's so unstable right now. We can't even tell you if we're just going to do yearly. Like, we haven't gotten to a point where we're so comfortable with this variant that we say, you know what, this vaccine right here and this booster will rock out for the year. We'll see y'all next year. We haven't even gotten to that point yet, which is again why some of us are like, oh, like we hate that it's happening. But yes, we will get some type of herd immunity. And I think for a lot, especially those who want to just kind of move on, right? Those who can't, like, all right, come on, guys, we got to, come on, let's just live our life, people, right? Those people want us to want to believe that herd immunity is already here. I don't think it is, or especially because not everyone's boosted, right? So yes, we'll get there. But I do think it's still going to take some time, and especially with those who need to get boosted from that perspective there. I want to see. Oh, and this is a great question, right? I love that, Billy. COVID will not have herd immunity unless the pan-vax works. See that, and that's it, right? That's clear as day. Because I can't just give you the one vaccine and say you're good to go, right? Like, you're not going to have the herd immunity. Like, I need it to slow down enough, slow down the deaths enough, slow down the rate of cases enough so that I can give you one shot for the year and keep it moving. And unfortunately, we are not there at this time. Oh, let's see. Yeah. Oh, and this is a very common one. So someone says, I've had COVID 3 times, right? So again, there's a lot of people, right? There's a lot of people who have never gotten COVID, and there's a lot of people who have just gotten COVID a lot. One, I am so glad that you've been able to have COVID 3 times and still continue to tell us about it, right? Because I know a lot of people who've gotten it once and have not. Hopefully you're good. Hopefully there's no long-lasting effects. I don't know if there's some significant genetic component that affects more people than others. There's so many different variables kind of associated with it, but I'm glad you're at least here to be able to kind of talk and say that. Now let's see here. Yeah, and then I had to answer this question. Someone was asking about the number of deaths. Yeah, that 900, like, we're averaging, because someone was asking about the deaths in the country, about 900 people dying yesterday. We're averaging about 3,600, 3,700 people dying a week from COVID. 3,700 people dying within a week. Now, mind you, we're in COVID, flu, RSV season. So this is definitely the worst time to have it. But that's kind of the numbers we're dealing with. So this is, again, so that's why when you see the news like this, you see us going like, oh, like, what do you mean? Because like people are still dying, unfortunately. Let's see here. Yep. Yeah, it's actually a very good point too, right? Because our same person who got it 3 times. First of all, again, we're glad you're here to still talk about it, because we've dealt with so many different variants. If again, obviously, I've taken care of patients during every single wave. I've taken care of patients during the initial wave when we kind of didn't know how to treat folks, right? We were just kind of like, please make it to the next day, which I'll be honest, the people I call it the OG strain. If you were in the hospital March 2020, right? That March 2020, the 21 before vaccines came around, and you made it, God bless you. Because the things that we did not know if you could do or not are like standard of care. Like I suffer from bronchitis, and so this will kill me, right? So I suffer from bronchitis. I usually get it every year around cold and flu season. So I go to, and obviously I'm in the hospital. I'm a hospitalist, right? So I go to the hospital. I go to the ER doc. Say, hey, yeah, I'm just dealing with another case of bronchitis, and they test me for COVID. It's negative. All right, cool. Yeah. So usually I just get some steroid treatment. I'm good to go. Like, oh no, we're not sure. This may be a false negative. So they wouldn't treat me with the steroids, because at that time, especially early in the beginning, and I don't know a lot of people realize this, we didn't even know if we thought steroids made it worse. So we wouldn't even treat you. So mind you, I'm like, I can't even breathe. They got a little oxygen on me. I can't even breathe. And I'm like, please just give me the steroid. They wouldn't give me the steroids. They finally had to be admitted to the hospital. I remember getting a COVID test 4 times, y'all. I got 4 COVID tests. I got a flu test. Negative. Like everything's negative. And then finally the ID doctor was like, all right, let's just try to give him some steroids. And I was gone in like 48 hours, right? Like that's how crazy it's been, right? Oh, see, so someone said I was in the hospital at 21. Yeah, see? Like if you were in that hospital pre-vaccine, because vaccines, let me see, I'm assuming Pfizer's didn't come out, I believe, until like that December, right? That December, like, so if you weren't, yeah, it was rough, because we were literally praying. We were literally praying like, all right, like maybe this will work. Maybe some antibiotics. Do I give fluids? Do I not give fluids? Like we were just kind of, it was a very, very wild time. Early COVID. So, and again, which is, I think, another reason why I'm such a strong encourager of the vaccine, because I saw how many lives got saved once vaccines came around. Because once vaccines came around and we had more data, so we had more treatment options in a hospital setting, right? So it wasn't a death sentence to go in the hospital. The amount of FaceTime calls I did to families before I had to, intubate their family member. I didn't intubate, I'm an internist. The amount of FaceTime calls, and I'd be honest with the family and say, hey, you know what? We're about to intubate your loved one. I'm not sure if we're going to be able to extubate. Those were real life conversations we had frequently. Which is why you see and I've talked about this as far as kind of burnout, especially for those in a hospital setting. It's the reason why burnout sped up so much for those who were really taking care, because we used to have conversations like that on a daily. Like imagine we don't clock in, right? But imagine going to the hospital and knowing that, man, if this patient gets intubated, I don't know. I do not know if they're going to make it. I'm going to throw everything out about the book, but I don't even know if they're going to make it. So that was a very big reality for us, right? So when the vaccines came around and our treatment options got better and we knew that we could use steroids and all these other things started happening, it's the reason why we became, especially people like me, became so much more vocal, because I knew a lot of people had never had that level of experience. Like you never made a FaceTime call to a family. You never told a family, I'm sorry, you can't come, even though your loved one passed, you can't come to the hospital to see them. We have to send the body to the morgue because the person's still infectious, right? Like those weren't the type of conversations people had. So it was so big for us that when we started having options to try to prevent people from seeing me, right? Again, I'm vaccinated, right? For trying to prevent people from seeing us, it was the reason why we're such a strong proponent of it. And Epi Lady said the best, right? Which I kind of mentioned as far as with these restrictions and these public health emergencies going down, underinsured, uninsured are going to take a hit. Now, mind you, underinsured, uninsured take a hit for every single thing. And I remember there was a lot of articles, especially in the beginning, that people were like, "Oh my God, COVID has unearthed the level of I don't want to say medical non-compliance, but just as far as just the lack of access and care for these certain populations." No, they've been there. Like, we've been knew about it. That wasn't shocking. That wasn't surprising. COVID was just another way to say, like, hey, look what happens to it, to this specific community when we talk about X disease, right? You take away COVID, that same issue happens with blood pressure. You talk about this, you take away COVID, that same issue happens with diabetes, high cholesterol, cancer. Like, it just continued to occur. So it was, for a lot of people, especially those who work on this side, we weren't shocked by it. We were like, yeah, that's unfortunately how it kind of goes in that regard. Let's see. So someone says vaccine made them sick, terminal, yikes, give both sides. See, I like this, right? So again, like I said, we're going to have a good discussion, right? So you have a lot of people, right? Let's, Mr. I can't put it. So this person says, vaccine made me sick, terminal, yikes, give both sides. He's terminal, yet he's talking on the TikTok, right? So this is what we would be talking about, right? Especially as content creators, that when we see people who kind of give comments like this, because it may scare the others, right? Fortunately, right, for people like me, right, and a lot of content creators I follow, which I love, is we got no problem calling these kind of crazy comments out, right? Like, you were terminal from a vaccine, right? Like, did you make the news somewhere? Because that's usually what typically occurs, right? It's always this sensationalized story of like, oh my God, you don't want to know what happened to me when I got the vaccine. And it could happen to every single person else, even though I just mentioned like 13 billion people in this country got it. Like, you think if 13 billion people got a vaccine of some sort, depending on which company, doesn't matter, and there was something significantly wrong, you don't think that we would have at least a million people get it? At least a million? That's a small number. Right? 500, like, you don't think any relation we'd see with that, but you know, it is what it is. They're too funny. Let me see here. Let's see. I believe folks who die in Vancouver is what killed them will result in COVID. Also, this is right. This is a very common question. This is more of a hospital related question, because I remember being in a hospital. So the user says, I believe folks who die and have COVID, regardless of what killed them, will result in a COVID death. Right. So this was a big thing that was on I think it must have been going through the anti-vaxxer groups, like, hey, like, just tell people that the doctors in the hospital, like me, are just marking down COVID deaths just to mark them down. Like that, again, the anti-vaxxers, they're very interesting bunch. Not to say this person's anti-vaxxer, they may be like anti-COVID vaxxer, which is a whole nother subgroup, which is a very interesting subgroup. That, like, they're okay with every vaccine, but for some reason, the COVID vaccine is where they have drawn the line, right? So you had this kind of theory from them that those who are on our side, those who had the right, because again, as a hospital internist, I'm the one filling out death certificates. They actually thought we were sitting back and saying like, yeah, you know, this person died from a car crash, but you know what? You know, that COVID would go good right here as a diagnosis. Like, that was kind of their mindset for a lot of the anti-vaxxers. I have no clue. Again, it must have been in some, you know, anti-vaxxer discussion group to like bomb like other people's comments across social media platforms. But like, we kind of debunked that quite often in that regards. Oh, yeah. So, I love Epilate. I think I'm following, but I got to make sure I'm following you after this fact here. I think the hospital costs will shock people. Oh, yes. Because if you get diagnosed with COVID, guess who's covering for it? The government. But guess what happens now? Like, and I've already given this scenario now. I've already given this scenario. Let's say you have insurance. Let's say you have insurance, and you're the one of the ones who don't get vaccinated, and then you go to the hospital for, you know, COVID-related illness, and then you get a crazy bill, and then your insurance company is like, "Are you vaccinated?" Like, they may ask you, "Where are you vaccinated?" Because it's in their records. Like, they'll know it. They may say, were you vaccinated? And boy, that might be a crazy discussion if they start saying like, yeah, we're not going to cover that. Maybe a crazy discussion if they say, we are not going to cover that. Let's see here. Someone said, I can show what happens when you're unvaccinated from COVID. Oh, yeah. That's something. I love that because, and again, those who know, if you know me, I'm a strong encourager of the vaccine. But I recognize I have my immunocompromised patients in the world who cannot take this vaccine. Recognize it. I recognize there are people who may have allergies who literally cannot take the vaccine. I recognize that. So I don't, look down at everyone who can't get the vaccine. I don't do that, right? I just recognize that, hey, you know what? If you can get the vaccine, protect others from doing it, right? Like that's what I stress. Like if you can do it, even if it's not necessary for yourself, think about others in that regards. Right. Oh yeah. Someone said to report to VAERS, and I think I did a live on that as well. And especially for those who may come on late. I will be posting this live on our YouTube page tomorrow. So you'll be able to catch it in that regards. I missed it. Oh well. Let's see. I think I'm sorry about that. You swipe left to the one bit, and then now all of a sudden, like it scrolls you all the way down to the bottom, right? So let me make sure I want to make sure I don't miss anything. Oh wow, y'all going crazy with the comments. We appreciate that. Let's see. Oh yeah, so I was talking about VAERS. So VAERS is one of those. It's a site where it's a public site where you can just report, if you had a complication, right? Now, again, it doesn't mean that just because you report it, that there's an automatic association with it, but if you can report it. And I remember the anti-vax, especially in the beginning, they used to like bomb VAERS, just spam them to try to drudge up, right, controversy of, oh my God, do you know that the vaccine causes your testicles to swell? Like it just wow. Yeah, healthcare costs. Oh yes. Oh, shout out to Team Public Health. For those who may not know, I have a osteopathic medical degree, but I also have a master's of public health thesis and program evaluation. Right, so I'm always Team Public Health. Healthcare costs over time because of long COVID. Oh yeah, that is shooting through the roof. It's already high now. Costs are down because it's being subsidized, but once that subsidy stops, yeah, we are going to be wild. It's going to be some trouble for sure. Yep, Cobra change is definitely happening. Someone said, is it normal to have COVID symptoms in day 12? Yeah, especially because typically the guidelines have always kind of give you that 5 to 10 day mark. Like, hey, after 5 days, if you got COVID and you're treated, all right, you're good to go. You can go back to normal. But they always stretch it up to 10, right? Because that's kind of the average. But I've had patients after a couple weeks, they're still dealing with kind of chest congestion. After a couple weeks, there's still maybe a little bit of a foggy sensation, sore throat like that. That can kind of occur. Cough is usually the one that usually stays around the longest. I've had a patient for like almost 4 weeks with the cough, and that just never went anywhere in that regards. Let's see. People shout out to people in Florida. Yeah, Florida. Yeah, y'all already know. Y'all know I'm a Florida resident, right? So, and I got DeSantis over here, so I got to deal with DeSantis. That's too funny. Oh, let's see here. Yes. Oh, yes. Someone said their husband. I'm sorry. Someone said cousin. My husband had COVID over Christmas, and I still haven't gotten it. We're truck drivers. Yeah. Like, again, I don't know how it happened. Like, literally my whole family. I got 3 kids. Let's see on here. I got 3 kids, and a wife. All 3 of them had COVID. All 3 of them tested positive for COVID. I ain't got it, and they all looked at me wild because, especially at the time. the guidelines were still kind of iffy on what to do with kids. So they were out of school for like 2 weeks. They're out of school for like 2 weeks because the guidelines said like, all right, they got to be out for like 10 days, even though like if it was 2 of them had tested negative, but because the third one still remained positive, like the whole household had to stay put. Tested positive. Oh yeah. Yeah, so China Doll says she tested positive for the first time. Today, everyone else in the house is negative. Yeah. And it's one of those things where, especially from a symptomatic standpoint, like you might have gotten symptomatic, the others might not have been symptomatic, so they might have been rocking with it like a week or so beforehand, possible, I don't know. And then by the time you get it, you're like, oh, I'm not feeling good. And boom, you go to test and then I'm positive. But by the time we go to check everyone else, it's kind of clear. And it's not surprising if, people in your house never test positive. It's just a very, and again, we're only 3 years, we're only 3 years plus into dealing with COVID, right? Oh, you want to join me live? Oh, yeah, sure. Give me a second. We have someone who wants to join us live. I love that. Give me a second here. Where can we? How do I? No, that's all right. I'll figure out how to add you on here to the live. Very great question. Do you think COVID is here to stay, meaning it will never go away regardless of herd immunity? Yes, COVID's not going nowhere. It's not going nowhere. We just got to understand that, like, yep, this is what we're going to have to deal with. But yeah, COVID's not going nowhere. Now, especially like just like monkeypox hasn't went away. We just not all in the news. Eventually, we want to get it to the point where the numbers are low, the deaths are low. We have multiple options on an outpatient basis to treat, and we don't have to worry about our hospitalizations being overran by a COVID, flu, RSV surge. Like, we want to get to that point. We're not there yet, but that's the point we want to get to. But that's why COVID ain't going nowhere. Don't forget. Yeah. Oh yeah. So someone said, don't forget, and I love this. We got to highlight, because again, the reason why it's free is because it's being subsidized. Don't forget to get your free mask paid for by insurance each month. Like, if you're walking around here, you haven't got your free mask, you haven't got your free testing, you better take advantage of it, because you at least keep it somewhere, right? Because once you can't get it, it's trouble. Yeah, we're gonna figure out how to get a Chow Papa online. Let's see here. Long COVID. And so someone, Darla asked, what about long COVID? Yeah, so long COVID is definitely the discussion, right? And I talked about, I've been talking about this a lot as far as our transition, because initially when we used to talk about like the mortality rate, and like, oh, COVID only kills 1% to 2%, like that was a big thing for those who are against the vaccine, against, social distancing and all this other stuff. For those people, like, that's what they used to stay on. And I used to argue, like, yeah, that's okay. But like, if a lot of people get COVID, even if they don't die, they're going to have to deal with the effects of it, right? They're going to have to deal with the effects of always maybe needing, an inhaler, being on oxygen, decreased fatigue. Some people have brain fog. They're going to have to deal with these long-term effects. If you're going to be on disability, I surely believe that COVID will be one of the number one diagnoses for people going on disability in the next decade or so. Like, that's what we're going to have to deal with over time, which is why we were trying so hard for people not to get COVID. We don't want you to get COVID, because even if you live, because we're doing a good job keeping you alive now, even if you live, you still got to deal with all of those. Let's see here. Let's see. Yeah, I wonder if we can. So this is a very good question here. So, Guardian Angel says, yes. So they asked, am I a hospitalist? So the answer is yes, I am a hospitalist. Am I seeing an increase in COVID admissions? I would say it's pretty steady. And especially when I see, because I practice in 3 different realms. So I practice in an acute care center. Like if you initially get sick, 911 to a hospital, boom, I'm in the acute care center. I practice in a long-term care center. So if you've been in an acute care hospital for a while, like let's say you've had COVID, let's say you've had some type of infection, let's say you've had some type of wound or something where you're healthy enough to not necessarily be in an acute care center, but you're too sick to go to like a nursing home or rehab, boom, you come to a long-term care center. And I'm taking care of patients in a rehab center. So I see patients at all three different levels, and I still see COVID at all three different levels. Again, much improved, especially at its peak, but definitely something to come on. Yeah. How do I? I'm not sure how do I add people on live? Because very good question. I don't know how to. Must be somewhere. I don't. Well, trust me, we will definitely find. Like I wonder if I can. Oh, nope. Oh, I think we got it. All right.
Hello, doctor. How are you?
All right. So first of all, thank you for joining the live.
No problem.
And the reason why is because I think a lot of times, especially when people talk about COVID, especially now, we talk about it in the abstract. We talk about like just this thing to know. And we never want to connect people to like a face. We never want to connect a face to the disease. So tell people about yourself. Well, you said you're a long hauler. You said you were in the hospital for a long. You were in the hospital during the time where it was tough to be in the hospital. Talk about that.
I had a 5% chance to live, and I lived. So I got COVID of January of 2021. Actually, when I went into the hospital was on the 25th of January of the 2021. It's going to be. I lasted 5.5 months in the hospital. 6 weeks in a coma, trach, ventilator, feeding tube, ECMO. I had to be airlifted to a different hospital for ECMO. They had to put 8 one-way valves in my left lung because it popped, because my heart was going to stop. And I barely survived COVID. Me and my mom and my daughter, we weren't not against the vaccine. We scheduled our appointment at the beginning of January. They couldn't get us until February 6th. To get the vaccine because everybody was getting it. Like it was that booked. So we took a vacation to Las Vegas, where my mom contracted COVID, and I had to take care of her and leave our vacation early. We both had to be intubated because while I was in the hospital in ICU, about 4 days into the hospital, my left lung popped from COVID. So I was at 50% oxygen. And then when it popped, they put me at 100%. Had to put me on my stomach. And then the doctor said, hey, look, your only option is intubation, and you might not even survive there. The first respiratory therapist kind of didn't convince me. And then a couple hours later, they said, look, you're dropping dramatically. I was in the low 70s on breathing. I was coughing for air. And I told the last respiratory therapist, I had asked her, I said, how are you? And she's like, I'm good. And I said, what type of person are you? And she looked at me weird. I said, are you that one that, excuse my language, BS's, or are you straightforward? And she's like, you want the truth? I said, tell me the truth. She's like, you're going to die. And I was like, okay. I said, so if I get intubated, she's like, you got 5% maybe less chance to live. She's like, that's your only option. She's like, this is why we're in here trying to save you. And I was like, all right, so she convinced me. And yeah. That was what led me into a 6-week coma. While I was in my coma this weekend, my mom passed away from COVID. She passed away on her birthday, which will be Saturday. She passed away February 4th while I was in my coma.
Oh, rest in peace.
So I lasted 6 weeks, like I said, in my coma. But the crazy part, doctor, is I heard everything when I was in my coma. Everything. I told everybody, if you can talk to them because I heard everything. I freaked out the doctors and nurses when I woke up from my coma. I was number 4 from the time that I woke up. Okay, number 4 out of 384 people to survive from the time I left the hospital. And every single one of us was unvaccinated. Every single one of us. You know,
You know what's so
everybody.
tough about that? I mean, this like I can close my eyes and I'm just hearing your story, and it just sounds like so many of the
Mhm.
patients we used to have to take care of. Like especially when you talk about, and he mentioned having to lay on his stomach at the time to try to get as much oxygen as we can before we would intubate people. We would put people prone to try to help with oxygenation. Now, mind you, again, and that respiratory therapist, you could tell she spoke from the heart because
Mhm.
we knew, like, if we had to intubate this person here, I don't know. Like, we
Yeah.
knew in our heart, but we knew that, all right, we're at the point where there's nothing else we can do if we
That's
don't
right.
intubate.
That's right. You
So
know, people are.
I could see you going through that whole. I mean, I'm just like I'm mentally picturing it because like you remind me so much of all of the patients, and then what's worse, especially when you just talk about your mom, the amount and the amount of families. And again, this is one of those things where again, when I talk about how burnout has sped up in the healthcare setting, especially for those who take care of people in the hospital, it's because we lost, right? We, the healthcare, we would lose families. Like it wasn't like this one person here and then the whole, like, no, we would lose families. I remember I lost one set of twins over here. I lost a sister over here. Like,
Mhm.
and while I'm taking care of the brother, it was so common, especially when it was the wild wild west.
Yep.
And the only thing we could do is like, all right, if maybe if I could get this machine to breathe long enough, your body will be strong enough to turn the corner. Because at that time,
Yep.
we're
That's
just
all you
praying.
can do.
We're just praying that if we give it just enough time, their body will turn around and fight it. Because we've thrown everything we can.
And you're right.
So I mean, your story is so touching because again, it just brings me back, especially when you say your mom. Because like I remember I took care of multiple families,
Mhm.
and what's worse, right? And especially you said you can hear. I had a few patients tell me that they can, and that's why even now,
See, and this
hi,
is how
Dr.
my
Pierre.
doctor.
Like I don't care how many medications you're on. I'm introducing myself. Hey, I'm about to listen. Like I want you to know because I'm like just in case
Yep.
this is one of the people who can actually hear what I'm doing. I want them to at least know that I'm acknowledging them as a person. And I could tell you probably one of the toughest things someone had to do was when you were able to come out 6 weeks later and someone had to be the first person to tell you,
Yeah.
hey,
See, and this is how I knew who my doctors were. Okay. So I was seeing three different physicians. They were all my care. So the way they had it set it up, it was two doctors. I don't know, there was every two patients, and then the first one was for all patients. That's how they had like a subdivision going. And I remember some random nurse holding my hand, telling me, you know, Robert, don't die, don't die. Many of you guys have died, and I was yelling in my head like, I'm right here, you
mm,
know. So finally, it was about 4.5, maybe 5 weeks. They called my daughter and they said, "Hey, we need you to come up here. We're gonna let your dad go," because they didn't think I was gonna survive.
mm,
I was showing no signs of improvement, nothing. So I remember all three doctors walked into the room. I had no idea who these doctors were, and they told the nurse, "Can you step out?" Two of the doctors said, "Yes, I agree." The third one said no.
mm,
So my daughter came. I remember her holding my hand, and damn, did I fight to like tell her, "I'm right here, baby girl."
mm,
I tried so damn hard to wake up, doctor. So damn hard, yelling in my brain like, "I'm right here, I can hear you." So when the doctor said no, I had finally woke up. I remember doctors and nurses running in and said, "Don't move, we're putting you back to sleep. We got to take the tube out." And so I don't know how long. I want to say maybe a couple of days I was out because I was in and out, like on so much drugs, you know. And finally, when I came to my senses, I had called all three doctors and I finally got to meet them. And I finally had the courage to say, "Hey, this is going to sound so weird, but I need you guys to do this for me." And they looked at me and I said, "Just please do it. I'll explain when I'm done." So I said, "Talk amongst each other, whatever you want to talk about. When I tell you to stop talking, I'll let you know and I'll explain why." So one of them started talking and I said, "Please stop talking." And I said, the other two continue. Then I told the second one, stop talking. And I looked at both of them and I said, doctors, I have no grudge. I hold no grudge against you. I understand that you guys didn't want, me to suffer and the family to suffer and start mourning. I said, I hold no hate or no nothing but love to you guys. And they looked at me. I said, you two wanted to discharge me, like turn off the machines because you
Mm,
didn't think I was going to survive. And
mm.
they looked at me and like, how did you know it was us too? I said, I remembered your voices. I said, that's how I could tell you guys from apart. Then my other doctor, Dr. Campbell, I looked at him and I said, Dr. Campbell, I want to thank you for saying no. And Dr. Campbell actually started crying because he's like, I can't believe you heard us. I said, I heard everything. I remember the nurse talking to me, telling me, Robert, don't die. I finally got to meet the nurse. And I explained it to her word for word. And she's like, oh my God, you did hear. And I was like, yeah, I heard you. I remember calling my daughter and she's like, because my voice was so graspy, it didn't sound the same. She's like, this is not my father. And I was like, I call her Mijita, and I call her Flaca, Flaca, it's me, baby girl. She's like, if you're my dad, where do we go to go eat? And we talk in private. And I was like, really, mija? I was like, we go to Chachi's restaurant. And she started crying.
Wow.
She's like, oh my God, Dad.
Wow.
She's like, it's you. And I was like, yeah, it's me, mija. I'm here. And she's like, and see, I thought I was in the same hospital. I didn't know they airlifted me when I was in my coma for ECMO. Because when I
Yeah.
said, can I have my daughter come see me? Can I have visitors? And they're like, yeah, you can. But they're like, we don't think she's going to make it. And I was like, what do you mean? And first thing in my mind was like, what happened to my daughter? Like, holy crap, you know? And they're like, no. They're like, do you know where you're at? And I made them laugh. I'm like, yeah. I said, I'm over here at Mountain Regional Medical Center. And they're like, no, sir, you're at Presbyterian Hospital. And I'm like, where the F is that? I told them.
Wow.
And they're like, we had to airlift you 4 hours away for ECMO. I was like, oh, I guess she's not going to make it then. And they started laughing, because I didn't know. I
Right.
thought it was still in the hospital, just in a room I've never seen before.
Right. And then for those who are on the live, like ECMO again was one of those.
Last resort.
Yeah. Like so when I'm hearing your story and I'm just hearing like, oh yeah, it was Hail Mary all around. They're like, we are gonna try every single thing. And that's what we were doing. We were trying every single thing, trying to like, all right, maybe this will work, maybe that'll work. Because we had seen so many failures, we were hoping like, all right, maybe this, and then you'd run into another failure, right? Another one of the family members passed away. So yeah, oh yeah, especially I can definitely tell.
And you can tell I had my
Yeah,
trach in my
oh yeah,
way.
oh yeah, I see it. I see
And
it.
I
And
tell,
obviously you're still on oxygen.
yeah, I still need, I'm on oxygen 24/7. It's only my left lung. I go to pulmonary and physical therapy 3 days a week. I have a myocarditis cardiologist. I have a vascular neurologist. I mean, it's so many things that I have to do, and it's just my whole month. And I tell everybody this, and I'm putting it in my book. I tell everybody, if you survive COVID, your problems are just starting.
Mm.
I said, do you think
Ooh,
that's
that's
the
a
worst
that's a
part?
word. That is a
I said, your problems are just starting. You cannot work. You have brain fog. You cannot sleep. Constant headaches. Constant pains. I have PTSD real bad. I had to get a service dog. And the reason I have dreams about all the time is because where my room was at, I seen the bodies coming out every day. That's
mm,
the only way in and out. There was no other exit. It was all like it was hazarded off. And I've seen countless bodies coming in. The only thing you think in your head is, when is it my turn? That's the only thing you can think of, though. You know, hospital bills. Mine surpassed over 6 million. My insurance paid 1.9 million and dropped me.
yep.
So you're in debt regardless. I mean, I had to file bankruptcy. I had to do everything. I mean, I lost everything. My home, my cars, everything. I was the sole provider for my family.
Especially because not only are you in the hospital, you're out for so long, and it's not like the bills pause,
Oh no.
right? And like they keep coming like, and there is no aid, right, for those who actually need the help,
And
right?
I was
So
blessed because my
were
daughter,
you like the primary breadwinner as well too? Was that another issue for you?
But my daughter had to step up and still go to school and work full time just to pay the bills until I filed for disability and finally got it approved. But
Which
it's
ain't
just
which tell them it ain't easy. Despite
oh,
this, like we're looking at you, and it's clear that you're
yeah,
disabled.
yeah.
But you would think it would be a simple couple of
Nope.
check marks here and then
It took
approval, we're good to go.
14 months to get approved. And most people have to file appeals.
Mm-hmm.
And mine took 14 months because all my doctors sent my medical work records to the fullest. Um, and it's horrible. And I tell everybody what I get on disability a month, I made every 6 days at work.
Mm.
I went from a six-figure salary to nothing. And I tell everybody, you don't want this. Like, you think you do, and you think it's a joke. Like you were saying earlier, people want to use the 2%. I'm going to put this 2% in this scenario. Okay. Okay. Let's take that 98% survival, 2%. You're at a baseball game, at the Yankees game, 50,000 people, 2%. That means 1,000 people are going to get COVID. What 1,000 people it's going to be, we don't know. Now, 2 days later, there's another game, 50,000 more people, another 1,000. I said it spreads like a wildfire, guys. Not only that, you guys may not get it as strong, but you're gonna may give it to somebody who's not gonna have the same chance you are. Why would
That's
you
it.
want that on your conscience? We all have people that are immune compromised. We all have family members, friends. Like I used to have grandparents. They were immune compromised. You think I want to pass that to them? Like, I never even got to go to my mother's funeral because I was in the hospital.
Mm.
And I tell people, you guys just don't want this. Like, you don't. It's not a joke. It's going to get you. And people say, oh, how is your health for? Yada, 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 this and that. And I tell
Oh
them,
yeah,
oh, look at my
they
kids.
always
I
try to.
worked
It's
out 5
always a
days a week.
victim
I
blame.
ran 5.
It's always a victim blame
Mhm.
that tries to
You
occur.
know,
Like, oh well, are you healthy? Like, it don't matter. It does not matter. COVID does not discriminate. COVID does not discriminate on who it wants to really get ill.
and look what happened to trainers that died. Here's also the kicker, doctor. Not only has society suffered, but I've also mentioned this many, many times at my speeches. Our medical staff, our healthcare workers have suffered more than we have. And let me tell you why. You guys, I knew you guys were always super important, but till I seen it for myself, you guys are like the frontline doctors. You may not take bullets physically, but you're taking them mentally. And the reason I'm saying this is because I've seen so many bodies coming out. I ask myself, how many nurses are going out of the room into a private room asking, what can I have done different?
Mm,
Crying their tears
mm,
out. How many
mm.
doctors are questioning their medical stuff, saying, what can we do any different? This is happening too much. I mean, I don't know how you guys hung on. Like, I mean, and
It's
I'm not saying you're hanging on. I'm
yeah, yeah,
saying,
yeah. No, no,
how are
no, no. I
you
think it's so funny, and
stable?
I talk about this when I see tragedies occur and mass shootings and all this stuff, and I say, wow, like I go to school, I get years of training just to be able to
Mhm,
kind of block it off, so I don't run into another room screaming. I said
mhm.
I don't know how the general public is able to absorb like the
Yeah.
news that is like coming at them forthright. So when you talk about seeing, body after body, right? When you talk about having the conversations over and over and over again, when you talk about saying, man, like, all right, I couldn't say this one too, like that is it's such harmful to the psyche. It's such
Mhm.
harmful to physicians and nurses and RTs and PTs and OTs and like CNAs and every
Yeah.
single person who
Everybody.
consistently has to like. First of all, shout out to the CNAs, right? Because they had to clean it.
Yeah.
Like it's so tough that again you said it best. I don't know how we deal with it. I just know that we understand that we're the ones who are supposed to do it. So when I
Right.
say like, all right, I'm okay being the one who's this is what I signed up for. I don't want other people like voluntarily having to deal with that.
Right. Yeah, and I get that. But just to put you guys in that kind of situation, I don't even know how you guys go home and try to be focused for your families.
Mm,
If
mm,
you're stressing at work, imagine just going home. Like this is why I tell everybody that knows me, that follows me, I hold you guys to the highest. Like I will back every true healthcare worker that believes in science up 100%. Because at the end of the day, you guys are the real MVPs. Like because of you guys, I'm still here with my kids, and a million plus people can't say that. You know, and that's not including the 33% long haulers, you know, that
Right.
are still aren't taking into consideration. 33% is the number right now for all long haulers. That is a huge amount, you know, and people are not seeing that. I say you're only seeing they made this political. When has science been political? Never.
Yeah, yeah.
You
Yeah, we could have that. We could have a whole yeah that we got a whole like yeah like it used to be just very matter of fact, and when it became that when it
yeah,
became the fact that I was having to argue facts versus thoughts, and I was like, all right, this doesn't make any sense. Like, what am I doing here?
yeah.
And
You
and
didn't go to
and
school for
especially because we're talking about people. We're not talking about numbers. I'm not talking about hypothesis. We're literally talking about people here.
people. Yes.
Shout out to all of the roses. Oh, we appreciate that. Shout out to
Thank
all
you.
of the roses. I haven't. I've been so interested. I haven't even been looking at the comments. Mm,
Yeah, they made it political because of money. You're right. They did.
yeah, yeah. It's so tough because now when you hear someone on one side versus the other, you never know whether the intention is general, right?
Yep.
What you never know is like, all right, do they really? I mean, genuine. Like you never like, are they really care about what they're saying? Do they really care about making sure that the people get who they need to get, or is it just for a political buck? Like again,
I
don't
tell
a
everybody,
week go by.
I
Like
don't
there's
go
not a
to
week that goes by that people don't say that I am a political shell or I work for the pharmacist. I mean for the pharmaceutical industry. Not a week goes by. It's so fun. I'm like just please tell me who gets paid so I want to get paid if I can, but
a.
I can assure you I don't.
I love when they say you're paid by big pharma. I was like, bro, I lost a $200,000 house. I live in a ghetto apartment. I lived in a hotel. You think if I was paid by big pharma, I'd be living in this dump? Like,
Mm,
really? Like, you know, and I tell everybody, I don't go to a politician for medical advice. I go to a doctor. Like, really, get it out of here. You know, and they want to, and again, I don't hate on nobody's religion. I respect everybody's religion. Whatever you preach is whatever you preach. But I tell everybody this: the doctor saved me, God is healing me.
yeah.
And they're like, oh no, God saved you. I said, no, if I have two broken arms and two broken legs, I don't go to a church to get healed. I go to a doctor to fix me. Then I go to God so he can heal me.
Mm,
Tell me I'm lying. Tell me I'm lying. I said, so if you have two broken legs, you're going to go to a church to get healed? Like, no, you're going to go see a doctor.
right.
They're the ones
Right.
fixing you.
Mm. Oh, I love that. I love the text girl said the guy, and this is usually my comeback, right? Especially because I gotta because people I talk to, right, is a lot of very religious people, and they always say like, nah, God got me, and I say, nah, God sent me here to take care of you.
Yes,
Like
he
he's sending,
doctors are
like
for
I'm
a
the
reason.
messenger. I'd be like, I'm the messenger. He's sending me. Like accept the message.
Yes, exactly. You know, and they laugh when I say that. It's the truth. I don't go to a church to get healed, like to fix my broken arms. I go to a doctor because he knows what
Yep.
he's doing. So
I stress all the time. Tell people like because I know because you kind of mentioned that you got a book. Like tell people like like what you're working on. When can I get?
well,
When?
I've been writing on a book. It's slowing me down a little bit because of finances and my headaches and everything. But I've done everything. I've studied long COVID so much. I've spoken to countless doctors, actually scientists about everything, getting a bunch of background, peer review, proven studies, everything. But it's about my journey.
Mhm.
Everything's about my journey and what COVID has done, not just to me, but to a lot of us. And I'm hoping to have it out by November, December this year. And
Okay.
I'm gonna put it also on ebook and everything and all that. And what I'd like to do is everybody's like, oh, well, you're gonna make good money. No, what I'd like to do because of the insurances, I'd like to donate 50% of everything to long haulers because they're not covering a lot of our medications. I mean, my inhaler alone is $366 a month.
Ooh. Now we can go on a whole tangent for my COPDers.
Mhm.
COPD asthma medication has always been ridiculously expensive. So,
Mhm.
and again, like if you're COVID, long COVID, guess which medications you're about to be on. Guess which medications you're gonna have to decide. All right, do I eat or do I take this inhaler for the month?
Yeah. And that's
Like,
sad that we live in a country that's so rich that we have to choose between rent and food or medical.
right.
That's what's so sad, you know? And it just, yeah, but that's what I've always done. So I'm trying to find somebody that will handle the finance part where I can just help anybody, even if it's helping you with $100 for your medical and you're a long hauler, boom, I'm in. Like I'm for it. Because I know if it wasn't for my TikTok family that I have, I'll be a real doc, I wouldn't be here. My TikTok family has helped me so much, not just support wise, but financially, helping me buy my medications. And I tell them, you don't have to send it to me, just pay the pharmacy, we'll set something up, this and that. And I owe my gratitude to my TikTok family, all my
Love it.
medical creators. I follow a lot of doctors, nurses, they follow me back.
Well, let me tell
And
you something because I do a lot of things on social media, but I have a podcast as well too. So whenever your book gets out, you wanna hop on the podcast,
okay,
we can definitely we will definitely get you on there, right? So I see someone Lux Hair Collection, right, and I want to kind of talk about some of their discussion, right, because this is a thing that I see a lot happen, especially with during this pandemic, is that there has been this weird. Oh, thank you for blocking them. We're gonna talk about it, but thank you for blocking them. There has been this weird, like twist of the story that physicians don't really care about nutrition, don't really focus on preventative care, don't really like there's just been this weird twist of the story that they feel that we want to jump directly to just
yeah,
giving you a medication, right? No, we don't appreciate it. Appreciate for kicking them out because they were just spamming us anyways. And it could be so far from the truth, right? Like no physician, especially primary care, especially my primary care internist, family medicine, pediatrician, even those in the hospital, we don't want to have to give you the medication, right? We don't want to have to do the surgical intervention, right?
mhm,
We want you to do the things that prevent you from there.
yeah,
But when we see that you've kind of gotten past that point, we're not gonna not exclude it. Like we're not
right,
gonna act like all right, like just go back and eat right. You should be fine. I know you just had a heart attack, right?
yeah,
So this change of the story that has got people to feel that we as healthcare professionals don't like care about making sure people are taking care of their nutrition and don't care about making sure people are focusing on eating the right things, exercising, all those things. It's just a revisionist history. It's very weird to us. Like now when even like when we talk now, when people say like, oh, you guys only push this, you guys don't preventive medicine. I'm like, where y'all been at?
yeah,
Like before COVID, many of us used to say, hey, you know what? If you wash your hands, if you wear a mask, guess what? You don't have to worry about the flu, right? If you wear exercise, we used to say the same things. But once you get past that point, we're gonna tell you like, hey, get your shot. Like so, it's just wild to me, and that's always an argument because they always feel like, nah, we're only trying to push like the pharmaceutical company. And I'm Haitian, right? So I have a lot of family members who like even though they see me all across these social media platforms, like I still got to convince them, right? I still
that's
got
right.
to convince them that like eating isn't the only way that they're going to get what they need to get, right? So like we understand it, but like just to think that we only care about pushing like controlled medications and we don't care about your nutrition, we don't care about all the functional medicine, we don't care about all of these other things. It's never made any sense for us.
Exactly. He's right, and it just, Paige, hello, Miss Page, love you too. It's just crazy. Like people say, oh yeah, I know. And I used to make videos. They'd say, I know 5 people that died from the vaccine. I said, do me a favor, tag me in the video, show me the death certificate where it says the vaccine was the cause of death, and
Mm,
I will make a video proving your statement. Oh, I'm not gonna do that. Okay, as a so all of a sudden, 5, 7, 10 people. Like really? I said, if the vaccine was so bad in my condition, I was unvaccinated, guys. I said it would have killed me. I'm 4 times vaccinated. Like, come on now.
right.
But it's just all nonsense. And then I seen some of these videos. where the vaccine injuries. And I'm like, really?
Yeah.
Like,
They,
really? Come on. Like, you guys are gonna go that far in debt to get clout or get famous or
oh
whatever?
yeah, they
Like,
are.
gee,
They are. They bombarded school board meetings, right? They
yeah, you know,
bombarded discussion board meetings. Like they were just so rampant with their lies. And fortunately, in this day and age where you had those on this side ready to just to match their energy,
yeah,
because there was a time, and I tell people all the time, like right now, right? We just dealt with a measles outbreak out of Ohio. And the reason why we dealt with a measles outbreak in Ohio is because like 15, 20 years ago, you had one of these celebrity people saying like the MMR vaccine causes this, and that. And because we weren't active in combating it at that time, 20 years later, we're dealing with measles. Like that's what happens. So
mm,
we are much better at, being able to kind of stand up and say like, no, that ain't really what it is. And that's why, again, that's why I appreciate your story, because it's like I can talk all day, right? I can tell people all day what I seen, but no one's gonna look at you and be like, nah, he's doing it for a paycheck.
I've told people this, and even people that are, I say people for the younger generation. Sure, some people have gotten myocarditis from the vaccine, but it lasts a week tops, and you're
Tops.
good. I said, try myocarditis without the vaccine. I said, I sit down watching a movie and my heart rate's 160, sitting down.
Mm,
I said, it's 10 times worse, guys. And I've also said to anybody against these so called vaccine injuries, I said, I will take all my medical records from before till COVID, after COVID, and put your medical records and let's put it public and see how the results come out. And they won't do it.
yeah.
I said, I'm not afraid to show my medical records. They're actually on my page. I've posted them on my page.
Mm,
I said, because I want people to understand that it's not a lie. COVID is real, and it's like, if you want this, good luck. But I don't wish this on my worst enemy. This is not a life to live.
mm.
You know?
Oh, let me see. Oh, come on, Saturday. I would love to join. I would love to join. Let me
Oh, yeah.
if you
Yeah,
could DM me, I would definitely love to. Because again, I think it's gonna be stories like yours, and I guess Heather. Like it's gonna be more stories like you guys,
it's all
especially
love.
especially now that long COVID is continuing to be the thing. Like it's gonna be your story that's really gonna help resonate with so many other people.
No problem. But I need to
Absolutely.
get off, doctor. I got to take some meds and then
Yeah,
relax and
I'm about to
everything.
get out of here too. Hey, first of all, I want to say I appreciate you.
No, thank
Um,
you.
Obviously, sorry for your loss, right? Sorry
Yeah.
for the experience that you had to go through, but I'm glad that you're at least here to kind of tell your story. And I know you have bigger and better things coming for you. I can just kind of feel it. I can kind of sense it. And again, I'm honest, like when you're ready, like I said, I have a podcast. I do this podcast thing. I do it more
Okay.
than TikTok, right? So when you're ready to tell you can come on, you can whatever you want to do. You let me know, and my platform is yours as well.
Thank you, doctor. I appreciate it. Everybody in the comments, thank you for the gifts, everything. Millie, everybody, you guys just stay safe out there, guys. Seriously, like, over here in my state up north, it's getting real bad. Hospitals are full again. And that's up north. I live down south, thank God.
Oh yeah, and I live in Florida where we act like it ain't happening.
No.
we
Don't
we
get
act
me
like it ain't
started.
happening. Oh, someone asked podcast. Oh, I have a Lunch and Learn with Dr. Berry podcast. I have my YouTube channel, Medicine Mondays. So the link's all in my bio. So yeah, definitely. We'll definitely make sure that makes that happen.
All right, doctor. Well, I started following you just so you know and everything. And everybody, if you want to see my medical records, that's just the beginning. It's way more now. I had to jump on the state insurance because I had federal government insurance and they
Mm.
dropped me after a cap. They said no more. And I'm like, well, I pay you guys $489 a month for the last 15 years and you're just dropping me? Like, really?
Yep, yep. It's a dirty game.
Oh, yeah.
It's a
It is. But hey, we're still here. We got to keep pushing somehow.
Indeed.
So.
All right, y'all have a great night. Appreciate everyone for joining. This week we do this Thursday nights, 9 p.m. I will be there Saturday, 7 p.m. I'm there. I'm not sure who's live I'm joining, but someone's going to DM me to let me know. Y'all be blessed.